You go to bed at a reasonable hour. You sleep through the night, or so you think. Yet when you wake up in the mornings, you're tired, you're exhausted, and you never feel fresh. You think maybe it's your phone. Maybe it's just the way you are. Maybe it's a lot of stress and a lot going on in your life. But very often, many of these can be signs of a sleep disorder. So there are subtle ways that our body warns us that something may be wrong with our sleep. Today I'm going to walk you through 7 of these signs that your body may be giving you. Stay with me and I promise you, some of them may surprise you. I'm Dr. Srishti Todi and I'm founder of TMJ Sleep Clinic. Here we treat patients who have chronic head and face pain, jaw pain, TMJ pain and various sleep disorders. I make these videos to help patients and other dentists and medical providers help understand some complex symptoms that can actually help improve our life. So the first sign of a sleep disorder very often is snoring. Snoring has always been considered as something that is harmless and that everyone does from time to time. Well, if it is only time to time, snoring can be harmless. But if it is something that is persistent or it recurs night after night or it is increasing in intensity, it is often a sign of an underlying problem. Snoring occurs because the airway narrows, and a narrowed airway in your sleep is never a good sign. It can even be a symptom of a more significant and severe disease called sleep apnea. So if you complain of snoring or your partner snores continuously through the night, it is worthwhile to get a sleep test to just evaluate your sleep and see what could be wrong with it. Sign number 2 is morning headaches. If you wake up in the mornings and you feel that your head is hurting, it is feeling heavy, then it may be a sign of an underlying sleep disorder. If you have something called sleep apnea, your brain doesn't receive adequate oxygen through the night. So when you wake up in the morning, because of the low oxygen throughout the night, the head feels heavy. And as you go about your day and you breathe normally and your blood oxygen start to stabilize, the headache settles. So waking up with a morning headache that sort of settles through the day is a cardinal sign of sleep apnea. So if you experience that, it's time to talk to your doctor. Sign number 3, waking up feeling unrefreshed or exhausted even after sleeping well. This is a very classic sign. Sleep is not just the quantity of sleep that you get, but the quality. So even if you sleep for 8 to 10 hours, but if the quality of sleep during those 8 to 10 hours is not good and is not adequate, you are likely to feel exhausted and tired when you wake up. Sleep quality can be affected because of a number of reasons, like sleep apnea, some kind of pain disorders, if you have insomnia and you don't get good quality restorative sleep, all of these can affect how you feel when you wake up in the morning. So constant tiredness or exhaustion during the day is definitely warrants a health checkup. Sign number 4 is repeated and frequent awakenings through the night. Waking up once or twice occasionally during the night is okay, provided you're able to fall asleep quickly. But if you find that you're waking up repeatedly through the night, or if you're having trouble falling asleep every time you wake up, it is a sign that your sleep is not adequate and that you're not reaching deep restorative sleep. We need to have continuous sleep for our sleep to be of good quality and for us to hit deeper stages of sleep that make us feel refreshed. So repeated and frequent awakenings can also be a sign of sleep apnea. So if that sounds familiar to you, it's time to speak to your doctor about it. Sign number 5 is waking up with a dry mouth. When you wake up in the morning and if your mouth feels very dry or your throat feels parched and itchy, it is a sign that you have been sleeping with your mouth open all night. Now, sleeping with your mouth open all night can be due to habit, it can be due to poor tongue posture, it can be due to snoring, it can be simply because as children, for example, have enlarged tonsils. So when they sleep, there's no space for the air to move in and out. So they sleep with their mouth open so that they can breathe better. So if you have any of these symptoms, it is always best to get your airway analyzed and evaluated to see what could be causing this. It could sometimes require some sort of surgical procedures, or it may require simply habit correction with some exercises to help you close your mouth and breathe through the nose during the night. Sign number 6 is nocturnal reflux or gastric reflux throughout the day. Certain disorders like sleep apnea cause us to have a lot of effort when we breathe in and out. Because of this increased effort of breathing, the acid in our stomachs pushed upwards when we breathe and when we lie down at night to sleep. This causes repeated reflux. Also, if you have poor quality of sleep or if you're waking up throughout the night, the stomach tends to produce more acid. All of this can contribute to disturbed sleep, and the disturbed sleep can actually worsen acid reflux. So reflux and sleep actually have a very interlinked vicious circle sort of relationship. So if you have repeated reflux, it is important to not just treat the gut problem, but also your sleep. Number 7 is brain fog or mental fog. If you feel groggy through the day, if you feel that your mind isn't as clear, if you feel you're not that sharp, it is a sign of disturbed poor quality sleep. It can be caused because of insomnia, which prevents you from sleeping well or prevents you from having good quantity of sleep, or it can be because of sleep apnea, which is causing repeated drops in your blood oxygen levels. Both of these really affect how the brain functions because the brain gets tired during the night if it doesn't get enough sleep. Sleep is very important for our brain to recover and rejuvenate and be fresh and agile in the morning. So repeated frequent disturbances in your sleep causes you to have more mental fog and to feel low during the day. So if that sounds like you definitely should talk to your doctor about this. So 7 signs: snoring, daytime fatigue, morning headaches, mental fog, reflux, dry mouth, and frequent awakenings. If you even have 3 or 4 of these, it is important that you speak to your doctor about them and screen yourself for sleep apnea or another sleep disorder. Very often, this will include a detailed history taking and maybe having a sleep test. And if you're a dentist, and if your patients present with these symptoms, it's always worth a chat to delve deeper into their history and see what may be the exact cause. All sleep disorders are manageable provided the diagnosis is correct. So talk to your doctor about your sleep symptoms and be healthy. Follow along to learn more about sleep, TMJ pain, chronic head and face pain, and just more tips on how to live a more fulfilled and well rested life. Thank you.